Moving on to the muscles and blood vessels of the upper arm, and as I mentioned previously, the muscles of the upper arm and the movements that these muscles create are dependent on where they attach, either onto the pectoral girdle or the shoulder. The muscles that attach onto the pectoral girdle typically produce movement of the shoulder and the upper trunk region, whereas the muscles that attach onto the humerus, which form our shoulder joint, typically produce movement of the arm itself. So for the muscles of the pectoral girdle, which include muscles such as the trapezius muscles, rhomboids, and pectoralis minor, we describe the movements that these muscles create using the terms protraction and retraction, depression and elevation, and upwards or lateral rotation, and downwards or medial rotation. Now we will go over these in more detail in class, as you really do need a live demonstration, but briefly, protraction is defined as an anterior and lateral movement of the scapula. So think about hunching your shoulders forward. Your scapula are separating and moving forward. Retraction is then the opposite of protraction. So this is the posterior and medial movement of the scapula. So think pulling your shoulders back and sticking out your chest. Your shoulder blades are moving backwards and coming closer together. Depression is when your scapulars move in an inferior direction. Elevation is your scapulars moving in a superior direction, so either pulling your shoulders directly upwards or downwards, kind of closer or further away from your ears. And then upwards or lateral rotation is rotation away from the midline. And so when we're talking specifically about the pectoral girdle, it's when the scapula rotates and the inferior angle, so that bottom corner of the scapula, moves laterally and upwards. Downwards or medial rotation is opposite, so it's rotation towards the midline when that inferior angle rotates medially and also downwards. For the muscles of the shoulder, and so these are muscles that typically attach onto the humerus, we use the terms flexion and extension, abduction and adduction, and medial or internal rotation, and lateral or external rotation. So again, we're going to cover these more in labs, but just to introduce you to some of those terms, flexion is a movement that decreases the angle between two body parts. So when we think about angles, we need to think about a movement starting from the anatomical reference position. So think someone standing upright, looking straight ahead, arms and legs down by their sides, and their palms facing forward. For flexion of the shoulder, this movement looks like starting your arm in this anatomical reference position and raising it above your head, straight out in front of you. So not to the side, straight out in front of you. Extension is then the opposite. So it's a movement that increases the angle between two body parts. For the shoulder, this is when you start your arm up above your head and you bring it back down to your side, but again with the arm in front of you and not out to the side. Now, I know this can be confusing. This is one movement that I sometimes struggle to picture in my own head. But when you're thinking about angles and an angle getting larger or smaller, you need to think about the shoulder in this angle here. So if we've got our shoulder joint up here, we're thinking about this angle starting in that anatomical reference position. So if we flex our arm or flex our shoulder, the arm moves up like this. You can see how this angle here is getting smaller. If you extend your arm or extend your shoulder, it's the arm moving back in this direction. So this angle here is going to increase. We then have abduction and adduction. So abduction is the movement away from the midline. I like to remember this by thinking if you abduct something, you take it away. So for your shoulder, this would be raising your arm again, but this time out to the side. So if you're making the letter T with your arms, you're bringing them out to the side. Adduction is movement towards the midline. So for the shoulder, it's bringing your arms back down to the side of the body. Medial or internal rotation is rotation towards the midline along the long axis of the arm. So if you're starting in the anatomical position, think about rotating your palms inward to face posteriorly. Lateral or external rotation is rotation away from the midline. So if you start with your palms facing behind you, you are rotating them laterally or externally so that they're facing the front again. But getting back to the muscles, and starting with the muscles of the pectoral girdle, and on the posterior surface of the body, we have the trapezius muscle. And the trapezius muscle is this large, flat, triangular muscle here. So it makes up a large portion of the neck and upper back or upper trunk region. Now, although this muscle is technically one single muscle, for the purpose of this unit, we break the trapezius down into 3 parts because of the different muscle actions that each part of the muscle creates. So we break the muscle down based on the direction of the muscle fibers. So this section here, also on the other side here, you can see those muscle fibers are running upwards. We call this part the upper trapezius. The section where the muscle fibers are running more horizontally, we call the middle trapezius. And the section where the muscle fibers are running downward, we call the lower trapezius. So in our upcoming lab exam, if we label this part of the muscle here and ask you to identify this muscle, for full marks, you need to tell me this is the lower trapezius. Now, our upper trapezius, it originates up on the skull and it inserts down onto the clavicle. And so it elevates our pectoral girdle when these muscle fibers contract. This part here that attaches to the clavicle wants to move up closer to the skull. The middle trapezius originates on the spinous processes of the vertebrae in this area, and it inserts onto the acromion and the spine of the scapula. And so when this part of the muscle contracts, this part comes close to the spine, your shoulder blades are coming closer together and it's causing retraction. The lower trapezius originates from the spinous processes of these lower down vertebrae. It also inserts onto the spine of the scapula, and so this portion of the muscle depresses the shoulder blade or the pectoral girdle when these muscle fibers contract. So we're bringing this part down closer to here. Also on the posterior surface of the trunk, sitting underneath that trapezius muscle, we have the rhomboids. And the rhomboids is a collective name for our rhomboid major, which is this larger muscle here, and our rhomboid minor. So for this unit, you can simply call them your rhomboids. Now, these muscles originate from the spinous processes of the last cervical and the first 5 thoracic vertebrae, and then they insert onto this vertebral or the medial border of the scapula. So when these muscles contract, they bring this part of the scapula closer to the vertebral column in that movement that we call retraction. Anteriorly, we have 2 pectoral girdle muscles. We have the serratus anterior, which is a large, flat, fan-shaped muscle between your ribs and the scapula. So you can see this muscle here, 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 and it kind of wraps around the back and the side walls of the thoracic cavity. It originates on this side, on the surface of the ribs 1 to 9, and then it wraps around and inserts onto the vertebral or the medial border and also the inferior angle of the scapula. So when this muscle contracts, it pulls the scapula closer to the ribs, pulling your shoulder blades forward in protraction. The other muscle on the anterior side is our pectoralis minor muscle. And so typically, although it's removed in this image, it hides underneath our pectoralis major muscle. And this muscle originates on the surface of ribs 3 to 5. And it inserts up into our coracoid process. So again, when this muscle contracts, this point comes closer to the ribs here, and it's pulling your shoulder blades forward in protraction. Moving on to look at the shoulders of the muscles of the shoulder. So those that insert onto the humerus. And covering the shoulder, we have our deltoid muscle, which, similar to the trapezius muscle, we break down into regions based on how the muscle contracts. So the anterior deltoid muscle is this part here. You can also see it here, which sits on the anterior or the front of the shoulder. It originates on the clavicle and it inserts onto the deltoid tuberosity of the humerus. This part of the muscle will pull the arm up into flexion. So it pulls your arm up this way, but it can also internally rotate the arm. So taking your palms from facing anteriorly to facing posteriorly. The middle deltoid runs along the top and the side of your shoulder. It originates on the acromion process. It inserts again onto our deltoid tuberosity. And this part of the muscle pulls your arm up and out to the side when it contracts. So it causes abduction. The posterior deltoid, so that's this section here and here, is obviously posterior or on the back of the shoulder. It originates on the spine of the scapula, inserts into your deltoid tuberosity, and given its direct opposite location to the anterior deltoid muscle, the direct opposition of the direction of the muscle fibers, these two muscles work in pairs. So where our anterior deltoid causes flexion and internal rotation, our posterior deltoid will cause extension and external rotation. The shoulder muscles on the anterior surface of the trunk include our pectoralis major muscle, and so this covers on both sides the major portion of the chest or the pectoral region. This has muscle fibers originating from the clavicle, from the sternum, and also on the costal cartilages of ribs 2 to 6. All of those origin points then insert onto the deltoid tuberosity of the humerus. Now, this muscle can produce shoulder flexion and medial rotation with these fibers that run diagonally. And you can see they run almost in parallel to those of the anterior deltoid. But the pectoralis major can also assist with adduction, or bringing the arm closer to the midline of the body, so out in front of you this time, with these fibers that run horizontally. So if your arm is up out in front of you, it will pull it closer to the midline of the body. Posteriorly, we have our latissimus dorsi muscles. So that's this muscle here and also here. It covers a large portion of the posterior trunk. These muscles originate on the spinous processes of our lower thoracic and also our lumbar vertebra, our lower 3 to 4 ribs, and then also the iliac crest, or that very top part of your pelvis. They wrap up underneath the arm and then insert into the intertubercular sulcus, which sits on the anterior side on the top of the humerus. When this muscle contracts, it pulls the arms down by the side in adduction, so adduction. Think about doing a lat pull down at the gym. But because this muscle kind of runs up underneath the arm and then attaches to the front of the humerus, it also assists with arm extension if you've got your arm out in front of you. and also medial rotation, so rotating the palms to now face inwards or posteriorly. On the posterior surface, we also have our teres major muscle. So this muscle originates on the inferior angle of the scapula, and then the same as the latissimus dorsi muscle, it inserts underneath the arm and then to the front on the intertubercular sulcus of the humerus. Now, given the similar sites of origin and insertion, as well as the fact that the muscle fibers of the two muscles run in the same direction, so along this angle and along this angle, these two muscles work together to produce the same movements. So we have adduction of the arm, extension of the arm, and medial or internal rotation. Our last group of muscles make up our rotator cuff. So these muscles are our supraspinatus, infraspinatus, teres minor, and subscapularis. And our rotator cuff assists in stability, coordination, and also movement of the shoulder. So our supraspinatus sits in our supraspinous fossa of the scapula, and it inserts onto the greater tubercle of the humerus. So remember, that was the projection that sits laterally on the top side of the humerus. When this muscle contracts, it raises the arm out to the side in abduction, abduction. Our infraspinatus muscle sits in our infraspinous fossa, so it's all of this muscle here, and also inserts onto our greater tubercle. And this muscle produces lateral rotation of the arm, so it rotates the arm back towards the posterior surface of the back. Our teres minor muscle, which is this little portion along here, the muscle fibers run in a similar direction to infraspinatus. It originates on the axillary or lateral border of the scapula. It inserts again onto that greater tubercle. And because of that similar angle of the muscle fibers, our teres minor also produces lateral rotation. Then on the front of the scapula, so we know this is the back of the scapula because we can see that spine. This is our front. We have our subscapularis muscle. This muscle originates in our subscapular fossa. So that's the fossa or the depression on the front of the scapula. And it inserts into the lesser tubercle at the front of the humerus. So our greater tubercle is on the side, our lesser tubercle sits anteriorly, and this allows for medial rotation. So this part moves closer to this part when the muscle contracts. Finally, the blood vessels that supply and drain the upper arm are nice and straightforward. So the region of the body between the neck and the upper arm is called the axillary region. So this is kind of this region here where you find your armpit. And then the region between your shoulder and your elbow, so this part here, is called your brachial region. So with that in mind, your axillary artery, which is a continuation of our subclavian artery into that axillary region, it begins where that subclavian artery passes the first rib, so about here, and then it ends as it crosses the teres major muscle about here. We then have your brachial artery, which is a continuation of your axillary artery, so beginning at the teres major muscle and then terminating where it splits to run down the two sides of the lower arm. The brachial veins, so these are the two veins along here, a continuation of the axillary vein. This should say axillary vein. I'll change that up on your slides. And so your axillary vein is this portion here.